Okay, so we're going to talk about a medication that millions of people depend on, but maybe in a way you haven't thought about it before. Let's stop thinking of it as just a drug and start thinking of it as a first responder, packed into a tiny inhaler ready to go in an emergency.
I mean, have you ever had that feeling? It is terrifying, right? That sudden squeeze in your chest, the wheezing sound, the feeling that no matter how hard you try, you just can't get a deep, satisfying breath. It's a feeling you don't forget.
Well, if that sounds familiar, you are so not alone. That physical sensation actually has a name. It's called bronchospasm. It's what happens when the muscles around your airways, the tubes in your lungs, suddenly clamp down and get narrow. And when that happens, you need a rescue fast. And that's where this rescuer comes into the picture. It's one of the most essential medications out there for breathing problems, and you probably know its name: Albuterol.
So what is this stuff exactly? Well, the technical term is a short-acting beta-2-agonist, which is a mouthful, so most people just say SABA. But honestly, the only words you really need to remember are rescue medication. Its entire job is to work incredibly fast to give you relief right when you need it most.
So who uses it? Well, it's usually prescribed for a few key situations. The big one, of course, is for immediate relief during an asthma attack or a COPD flare-up. But it can also be used to play defense. People often take it about 15 minutes before they work out to stop breathing problems before they even start.
But how does it actually do that? How does it perform this incredible rescue inside your own lungs? Okay, this is where it gets really cool. I want you to think of it like a 4-step special ops mission. Step 1, you inhale it, sending the medicine straight to the trouble zone. Step 2, it targets these very specific little docking stations called beta-2 receptors that sit on your airway muscles. Step 3, it activates them, kind of like a key turning in a lock. And finally, step 4, that signal tells the muscles to just relax.
And the result of that mission? I mean, it is a night and day difference. Before, you've got this tight, squeezed airway that's causing all that wheezing and coughing. And then after albuterol does its thing, that airway is wide open. Air can move freely, you can breathe easy again, and it even helps clear stuff out. It's amazing.
Now, this rescue mission doesn't always come in the same package. There's a whole toolkit of albuterol options out there because different situations and different people have different needs.
You've got the classic one, the MDI or metered dose inhaler, that little L-shaped device that puffs out a fine mist. Then there's something called a DPI, a dry powder inhaler, which is cool because you activate it just by taking a deep breath. And for really serious attacks, or for people who just can't use an inhaler, like little kids, there's the nebulizer. That's the machine that creates a continuous mist you breathe for a few minutes. And listen, here is a huge pro tip, seriously. If you use one of those standard MDI inhalers, using a spacer with it, it's that clear plastic tube that attaches to the mouthpiece, is a game changer. It basically slows down the medicine so you can breathe it in properly, making sure more of it gets deep into your lungs where it's needed instead of just splatting against the back of your throat. Okay, we know what it is, we know how it works, but now we're going to get to what is, without a doubt, the most important part of this whole conversation: how to use it safely. Let's just call these the rules of engagement. First things first, it's pretty normal to feel a little weird after you take albuterol. It is a stimulant after all, so don't be surprised if you feel some tremors, like your hands are a bit shaky, or if your heart starts beating a little faster. You might even feel a bit jittery or nervous. That's all pretty common.
But, and this is a big but, the single most important rule here has nothing to do with those side effects. It has everything to do with one simple thing: frequency. It's all about how often you're reaching for that rescue inhaler. This is the part you really need to hear.
So what's the number? I want you to burn this number into your brain. The number is 2. That's it, just 2. Here's the deal. If you find yourself needing your albuterol rescue inhaler to relieve symptoms more than twice a week, and we're not counting the times you use it before exercise, that is a massive red flag. It's a signal from your body that whatever is causing the problem in the first place is not under control, and you absolutely need to talk to your doctor about it.
And that idea leads us perfectly into the final, absolutely critical concept we need to understand to stay healthy. And that's the difference between a rescue medication and a controller medication. It's actually really simple, but so important. Albuterol is your rescue medication. It's for right now, for sudden problems. It's a fast-acting, quick fix. A controller medication, on the other hand, which is often an inhaled steroid, is all about long-term prevention. It works slowly in the background every single day to manage the inflammation that's causing the attacks to happen in the first place.
Here is the absolute best way to think about it. Albuterol is the firefighter. You call them when the house is on fire and you need help immediately. A controller medication, that's the police officer who patrols the neighborhood every day, keeping things in check so the fire's less likely to ever start. You need both, but they have totally different jobs.
So let's wrap this up. What are the key takeaways? Number 1, albuterol is for quick relief of sudden symptoms, period. Number 2, if you need it more than twice a week, that's a warning sign. Call your doctor. Number 3, you have to understand the difference between a rescue med and a control med. And finally, number 4, none of this works right if your technique is off, so make sure someone shows you how to use your inhaler properly.
And that leaves us with one last question, and it's really for you to think about. Is your albuterol just an occasional lifeline for an unexpected emergency? Or has its frequent use become a quiet warning sign that something more needs to be done? Your answer to that question could be the key to breathing a whole lot easier.